So now we're going to look at how kind of all of the information from the endocrine system kind of interacts as far as resistance training is concerned. So look at the primary anabolic hormones, and one of the primary anabolic hormones is testosterone. This is the primary androgen that interacts with skeletal muscle. Looking at kind of the total science behind testosterone and everything, dihydrotestosterone is the primary androgen that interacts with the sex-linked tissue, in this case being the prostate, if you go back to the earlier illustration kind of showing how kind of testosterone is utilized in the body to promote various functions. So heavy resistance training using 1 or 2 repetitions in low volume, which may not cause any changes in testosterone concentrations after a workout, could potentially still increase the absolute number of receptors and binding sites available to testosterone. So we're not totally sure as far as what the actual effects on receptors is really yet, but the key is that receptor binding obviously is what we have to have in order for changes to occur. So circulating levels of the testosterone, or any hormone for that matter, is important, but again, the binding site is going to be the key to kind of sort of stimulating what goes on physiologically after a workout. So circulating testosterone is proposed to be a physiological marker for both men and women when looking at anabolic status. So we think that it could contribute to anabolic status or building up of more muscle, but by itself, it's not the only important factor. And part of the thing is that the levels of the circulating hormones don't provide a marker of motor unit activation and metabolic demands beyond just what's associated with receptor binding. So in other words, it doesn't give insight into the actual physical motor units that get recruited or the other metabolic issues associated with muscle and strength production. So still looking at testosterone, it could have both direct and indirect effect on tissues. So one of the things that testosterone can do is it can promote growth hormone release from the pituitary gland, which can also influence protein synthesis. So that's an important effect to note. So the increase in testosterone can do that. It also does have an influence on the nervous system, so it can actually interact with receptors on neurons and increase the amount of neurotransmitters. So the neurotransmitters are the chemicals that transmit information between within the nervous system, and this could also influence protein changes. Sources for men and women, obviously in the men, the reproductive organs are going to produce larger amounts of testosterone than in women. In women, the source of testosterone is going to be the adrenal glands. So in men, that's again part of the reason why men have higher levels of testosterone, is because of the reproductive system and the gonads being a large source for testosterone. All right, so still looking at testosterone. So first, before I get into what we're going to be talking about as far as resistance training, it should be noted that they have found increases in peripheral blood concentrations of testosterone during high-intensity aerobic endurance exercise, as well as resistance training. However, the high-intensity aerobic exercise can cause traumatic catabolic tissue response, which can increase levels of protein synthesis. However, what they find is that hypertrophy typically does not take place with aerobic endurance training, and then actually the oxidative stress from it can actually possibly decrease the muscle size. So while there can be an increase in testosterone with the high-intensity aerobic exercise, it doesn't produce the same hypertrophy or increase in size of the actual muscle tissue. So these are exercise variables that can increase serum testosterone concentrations as far as resistance training exercise. Large muscle group exercises, okay? So we're talking multi-joint strength training movements, things like squats, your Olympic lifts, your deadlifts. Relatively high resistance, so they're recommending in the 85 to 95% range. A moderate to high volume of exercises, so you have to have a good volume of work to produce that response. Short rest intervals, anywhere from 30 seconds to a minute. And they also feel that, experience is going to assist with this as well. So a lot of times in individuals who just begin strength training, particularly younger people, they will tend to get stronger first and then develop hypertrophy later. And the reason why they get stronger first is that it's more of a nervous system adaptation that's taking place in their bodies to just be able to recruit more muscles. And then later on down the road, they develop increases in muscle size. It should be noted, and the book talks about the concept of diurnal variation. So this is just the fluctuations of hormones throughout the day. So during the day in men, they do tend to drop, but you can actually get them to increase. So obviously exercise could change that. So even if, the hormones are normally dropping during the day, you can produce, an increase or maybe even get a little bit of a spike from doing exercise during the day. So kind of the key point with this, as far as resistance training is concerned and looking at testosterone levels, the key is large muscle group exercises using a good volume will result in an acute increase in total testosterone concentrations in men, more so than women. So some more information on testosterone. So we're going to talk about free testosterone and sex hormone binding globulin. So all when you hear the term free testosterone just means that it's unbound. So it's not bound to a protein. Free can be, increases in free protein can be seen based on age, or free testosterone rather can be based on age. Younger men do tend to have more. So they tend to have more free testosterone, and they also tend to have more total testosterone. So you'll just look here, just some information on free testosterone. So it accounts for only 0.5 to 2% of total testosterone. So higher total testosterone concentrations allows for more free or unbound testosterone. And here we see, here again, heavy resistance exercise. They found 6 sets of 10 repetitions at 80% of a 1 rep max can acutely increase free testosterone in both men and women, although the increase is much smaller in women. And again, that's just due to the physiologic differences in the fact that the male reproductive system is responsible for producing a large amount of testosterone in their bodies. Now, so we'll look at this in regards to women with testosterone. So the responses in women, so women do have about 15 to 20-fold lower concentrations of circulating testosterone than men do. And again, that's just due to the reproductive system being differently. And however, the testosterone concentration can vary pretty substantially differently between individual women. So some women do naturally secrete a higher concentration of adrenal androgen. So again, remember we said the real source for testosterone in women is going to be the adrenal glands. And, if some women do produce more testosterone, so, kind of when you're looking genetically at, certain females and the sports they're in, particularly strength and power sports, some of that is they are more genetically predisposed to, being stronger and, being able to produce more strength and power. Now, this is only usually the increases that you usually see in women through training is usually only for free testosterone. So it's not necessarily for total testosterone. But that's an important point to note, that in women, there are some substantially different amounts and concentrations between women as far as how the adrenal glands are concerned. So this is a chart in your book that looked at a study. So this is looking at the testosterone response in men and women. So this is in response to 6 sets of squats at 80% of a 1 repetition max. So 1 repetition max is just the most you can do. They take 80% of that, and they do squats with that exercise and with that weight rather, and you get about 2 minutes rest between sets. So chart A is looking at total testosterone, B is looking at free testosterone response. If you see a little star above a note, that note's a significant increase from pre-exercise values. And if you notice, and the hashtags indicates a significant difference from women at the corresponding point. So if you notice in looking at this, obviously the changes are much more significant as far as males are concerned, but you do get a response from women. But as you notice, given the fact there's basically a hashtag at every single point, you're getting a significant increase in men relative to women. So obviously the changes in males are going to be much more significant. And again, it's just due to the different physiology between the genders. So again, looking at this, so training adaptation, so testosterone increases in response to the demands of an exercise protocol, and then the receptors either increase binding to use the elevated testosterone, or they do not due to the lack of the need for the signal to increase muscle-related metabolism. So we know that we get these changes in testosterone in the circulating levels of testosterone. Again, there's the exercise mode needs to stimulate this. So again, that's the key thing. So training time and experience may also be factors in altering the resting and exercise-induced concentration of the hormone. So those will also be individual factors even beyond the training. There's also a role in the size that may be based and changed on genetics, and that actually goes, I know I mentioned that with women, but that can also be an issue as far as males are concerned as well. And again, I mentioned the exercise protocol needs to be able to stimulate this. So again, adequate stimulus, multiple sets, 5 to 10 repetition maximum sets can help put on adequate muscle mass. It's also important carbohydrate and protein ingestion before a workout. They do also believe can play a role with this. So there are various things that can play a role, even including nutrition. And then there's receptors on other targets may also be affected at certain points in training. So depending upon the window of adaptation. So in other words, nervous and satellite cells. So this also plays a role in nervous system development. So even beyond the anabolic changes that we're looking to have occur in muscular tissue, there's also going to be adaptations in the other systems as well. Okay, so moving on, looking at growth hormones. So another one of the primary anabolic hormones. It's produced in the anterior pituitary gland. It's important for normal development of a child. So again, it's going to allow for the development of all tissues in the body. So the target tissue for growth hormone, again, we're not just looking at skeletal muscle, we're also looking at bone, various immature cells throughout the body, fat cells, liver, tissue it'll also play a role in the development of all those other tissues. Here what you're looking at is a diagram of just the growth hormone cybernetics and interaction. So it's just kind of showing how growth hormone interacts with the various areas of the body. So take a look at that in regards to various functions. So however, just like testosterone, it also plays a vital role in adapting to the stress of resistance training. So this also helps us to utilize fat for energy and inhibits glucose uptake. So it actually helps in increasing blood glucose. So it plays a role with a lot of different metabolic and physiologic processes within the body. Okay, so primary anabolic hormones, growth hormones, again, main physiological roles of growth hormone and its superfamily or its associated properties. Decrease glucose utilization, so it's actually going to increase glucose levels. It does act as a insulin antagonist. Okay, so insulin helps with glucose uptake. Growth hormone is an insulin antagonist. It also helps with increasing the use of fats for energy as well. Decrease in glycogen synthesis. which you would have because you're decreasing glucose utilization, increases in protein synthesis, increased amino acid transport across cells, increased utilization of fatty acids, which we talked about, so you're going to increase the amount of fats utilized for energy, increase in collagen synthesis, and stimulates cartilage growth. So you see the effects that you're going to have here on the tissues of the body, particularly the increases in collagen and the stimulation of cartilage growth. So all that increases in protein synthesis and the amino acid transport will assist with the physiologic changes in the tissue that was discussed. So physiological roles continued, increased retention of nitrogen, sodium, potassium, and phosphorus. It enhances immune cell function, and it kind of showed on that little diagram on the earlier slide, kind of showing all the various functions. Increases renal plasma flow and filtration, so it does impact the kidneys, and increases lipolysis or fat breakdown, which again, it helps us to increase our use of fats for energy. So we need that in order to, we obviously need the fat to break down to be able to use it as energy, and that process is known as lipolysis. So growth hormone, as far as responses to stress, so resistance training, intensity threshold can be reached and rest periods influence. So much like you have with testosterone, again, it's going to be dependent upon how you program the resistance training. So growth hormone release is going to be affected by the type of resistance training protocol used, including the duration of the rest periods. So like testosterone, short rest periods within the workouts are going to result in greater serum concentrations compared to long rest protocols. Okay, so again, you have to look at what your goal is for the resistance training. If you're looking to get increases in size and hypertrophy, you want to do shorter rest periods. However, if your primary focus is strength, you're obviously going to want to increase the rest periods. Okay, so the short rest periods are going to be what do this. And again, the most dramatic increases will occur with short rest intervals. Again, you know, for instance, high volume protocols, 3 sets of 10 with short rest intervals will be the thing that primarily stimulates the release of growth hormone. Now we look at some of the differences with women. Again, hormone concentrations and hormone responses to exercise can vary with the menstrual cycle. So again, another difference as far as the you know, just general physiology is concerned is the fact that the female reproductive cycle and the menstrual phase will influence hormones. So women can actually have higher concentrations than that of men throughout the menstrual cycle. So in this case, a female may actually be producing more growth hormone. And now, as far as how that's going to impact resistance training, the mechanisms for the variation are unclear. Studies show that, again, same thing, you know, high volume, so 3 sets of 10, 1 minute rest, they can show increases in it. It should be noted that the responses of men and women using the same protocol have the same response patterns when compared. So regardless who's producing more, they still have the same response pattern. So obviously it'll increase in both. The biggest neuroendocrine differences for men appears to be reduced levels of concentration of testosterone and different resting levels of concentrations of the hormone. So those are some different things that when you're comparing between men and women, kind of what you want to be looking at as far as physiology is concerned. So as far as training adaptations are concerned, so one thing to note is that in order to really see what's going on with growth hormone, you need to measure over a longer time period. So, you know, even over a 24-hour span to show whether changes are actually occurring with resistance training. And the area under the time curve, which includes pulsatile effects, in other words, meaning, you know, raising and lowering of the concentration, tells whether changes in release have occurred. So it's a little more complicated as far as how you're actually measuring the growth hormone concentrations. And differences in feedback mechanisms and changes in receptor sensitivities kind of influence growth hormone adaptations with training. Also, you have the fact the issue of its interaction with insulin-like growth factor, which we're going to talk about next, and the dineural variations and maximal exercise concentrations are all things that will, additionally affect beyond what even you're doing with resistance training that will kind of mediate the growth hormone adaptations with training. So again, it's not as simple as even just while we know the type of resistance training protocol that will promote those effects, there are other things that are also going to kind of influence what goes on as far as the adaptations from growth hormone with exercise. Okay, so that takes us to insulin-like growth factor, and we'll talk about the exercise responses of insulin-like growth factor. So first of all, just what the hormone actually is. It's an important biomarker for health and performance, so there's various things that are influenced by insulin-like growth factor. The liver will actually secrete after growth hormone stimulates the liver to produce it, so the cells in the liver will produce this after it gets stimulated by growth hormone. Thyroid hormone and testosterone also play a role in the function of this hormone. It does play a role in protein anabolism, or the building up of proteins, but not in the classic way of working. So in other words, exercise by itself doesn't necessarily cause an increase. If general levels are low, it will increase. However, what we find is that in particular, nutritional status plays a very large role along with just insulin levels in general. So if you look at this picture, you see the result of a resistance training protocol being carried out with and without a protein and carbohydrate within a 1 hour recovery period of working out and also before the workout. And you notice that with the protein and carbohydrate supplement, that the response of insulin-like growth factor is greater. So obviously nutritional status is going to play a role with this in order to increase secretion of it. So the training adaptations as far as insulin-like growth factor is concerned. So it should be noted like I said before on the previous slide, it works a little differently than some of the other hormones we talked about. So the changes that are going to occur as a result of training are going to be based on starting concentrations of it before training. So in other words, if the concentrations are low, they'll increase. If they're already high, there's going to be no change, or they may actually decrease. Plus the intake of food influences. So if you have some, again, protein and carbohydrates around your training time, that's going to play a role with it, okay? Some of the other things probably reflected in a variety of mechanisms related to the type of insulin-like growth factors, release, transport, and receptor interaction. So again, multiple factors are going to play a role with this. There's also going to be interactions with other anabolic hormones so that the target can produce the same outcome. And again, adaptations to heavy resistance training in various tissues will still require further investigation. So we still do think that there are going to be some other interactions with other anabolic hormones. Again, exercise mode specific adaptations play a role, much being what we talked about before, but that in conjunction with the nutrition is also going to play a role as far as how it influences. Again, the target outcome, just as it is with all of the other hormones, is going to be an increase in protein synthesis, because that's essentially what you want in order to have that anabolic effect on the muscular tissue. So now we're going to move on from the anabolic hormones. We're actually going to look at the adrenal hormones here a little bit. Again, make sure you know all the function of the hormones on that the endocrine system review. Here we're just talking about kind of the responses in regards to exercise. So cortisol is actually one of the hormones produced by the adrenal glands. It's produced in the adrenal cortex. It's a glucocorticoid. Part of what it does is responsible for carbohydrate metabolism as it relates to the glycogen stores in the muscle. And levels of cortisol tend to be highest in the morning and drop as the day progresses. So now cortisol is actually a catabolic hormone. Okay, so it stimulates catabolic effects. So it's not anabolic like the other hormones we discussed. It's catabolic. So it stimulates the conversion of amino acids to carbohydrates. So it will do that in cases where carbohydrate levels are low. So it will actually break down amino acids to use it as energy. Increase in the level of proteolytic enzymes, and again, those are the enzymes that will break down proteins. Again, if this is where you have to kind of watch with diet and how you're monitoring your level of carbohydrates, because your body will utilize protein in order to raise blood sugar, and that's what this is essentially trying to do. Your body will catabolize proteins in order to do that. Inhibits protein synthesis and suppresses glucose-dependent processes such as glucogenesis and immune cell function. So there's different catabolic effects and actually effects on the immune cell function through the secretion of cortisol, okay? And cortisol is going to have the greatest effect on type 2 fibers because of the fact they have more protein in them. So those type 2 fibers that are more adept at strength and power production and also hypertrophy. Also during times of injury and disease, you tend to get an elevation in cortisol, which causes a net loss in the contractile protein. So you'll actually start, even during times of injury and disease, you will experience atrophy or a decrease in size of the muscle tissue. The anabolic effects of testosterone and insulin look to counter cortisol. So they will actually use receptors to try to block cortisol. And there's actually acute increases after training. So cortisol is a stress hormone. So obviously, but through training, you're inducing a stress. So you need to be able to leverage your anabolic hormones. So if you're someone looking to increase your muscle size, you have to leverage the anabolic hormones to kind of limit the impact of cortisol. And again, nutrition will also play a role with that, because if your carbohydrate levels are low, that's going to cause your body to utilize proteins in order to raise your blood glucose. So looking at what goes on with the with cortisol, so resistance exercise responses. So there's a dramatic response to particularly exercise that stimulates anaerobic metabolism. Essentially, what we talked about before: the rest intervals are short and the volume's high. The selection of exercise that produces the highest catabolic responses also produces the greatest growth hormone responses. So again, selecting exercise that will stress the system more, particularly multi-joint exercises, will also not only stimulate this, but will also stimulate growth hormone. So again, you're trying to balance out the effects of both breaking down and building up tissue. Now, increases in cortisol might not have negative effects in men after a period of training to which the body has adapted. So in other words, if someone is chronically producing large amounts of cortisol, that could have negative effects. However, acute increases that you get with well-timed resistance training doesn't necessarily won't harm the individual, even though we know that it does break down muscle tissue, but it's part of that whole adaptation process. So once you get that disinhibiting effect on cortisol, you could thereby maintain testosterone as the primary influence on its receptors. So in other words, the acute increases as you adapt to being able to tolerate that. Not only will you still be able to maintain an anabolic response, but you can actually get an effect as far as being able to remove damaged proteins from the training process. So the impacts of the acute responses of cortisol may actually play a role in the remodeling or an increase in the size of the tissue. Now, as far as immune response, so when we're looking at immune cells, so B cells and T cells are some of the cells of the immune system, and they do have a direct impact on recovery and remodeling of tissue. So there is a degree of immune suppression after intense exercise. So the resistance training protocols that use high volume, large muscle groups, short rest intervals will result in an increase in cortisol, but the high concentrations of cortisol may have adverse catabolic effects. However, acute increases still contribute to the remodeling of tissue and maintenance of blood glucose. So in other words, even though cortisol is catabolic and you will always get acute increases, as long as you're recovering appropriately, those acute increases will actually still contribute to the benefits of resistance training. It's only when there's a chronic high levels of cortisol in the body where, and again, that would be, seen in something through where someone, resistance trains, they don't eat the right way and they don't recover the right way. That will cause more chronic levels of cortisol, which will then, have some of the negative effects of, muscle atrophy and things like suppression of the immune system. Okay, another group of the adrenal hormones are the catecholamines, or we talk about epinephrine and norepinephrine. Now, these are produced in the adrenal glands, but they're produced in the adrenal medulla. So the roles of these hormones, they increase force production via central mechanisms and increase metabolic activity. Okay, so these are your adrenaline hormones, if you will. So they produce that increase in force. They can increase the muscle contraction rate. They also increase blood pressure, increase energy availability, increase muscle blood flow via vasodilation, so they cause the blood vessels to dilate and get larger in diameter, which will increase muscle blood flow. And they augment secretion rates of other hormones, such as testosterone. So much like we talked about with some of the other hormones, they also impact secretion of other hormones. So again, these get sent out when a body is stressed as well, which again, resistance training is a stress imposed on the body. Typically, the response, again, is going to reflect acute demands of exercise, particularly, relatively high intensity, short rest intervals, okay, good with a good volume. Important to vary training, because if the adrenals remain too engaged and recovery is delayed, you might decrease the ability of the adrenal medulla to release these. So in other words, this is where we get back to that. If you have chronically high levels of cortisol, will limit the release of these adrenal hormones. So in other words, epinephrine and norepinephrine will get suppressed if there's high levels of cortisol. So that's where recovery is going to be important. So we want epinephrine and norepinephrine while we're exercising to be working, because as you see with these effects, they produce some of the positive effects that you want to get out of resistance training. Also, the more muscle fibers you recruit, as far as the type of resistance training, typically you're going to get a greater remodeling process with this. So, only muscle fibers activated by resistance training are subject to adaptation, and that includes the hormone response. So that's part of the reason why you want to make sure that you're, again, utilizing the appropriate exercises and being able to recruit your motor units in order to get your benefits. So again, training adaptations, heavy resistance training has been shown to increase the ability of an athlete to secrete greater amounts of epinephrine during maximal exercise. So you're kind of seeing a common theme here as far as the resistance training protocol. So we want heavy resistance, we want high volume, we want short rest intervals, okay? Large muscle group exercises, okay? Now, you do need to vary your training protocol. So it's important, just like we talked about, it's also important to recover. So there may be times, and this is where the limiting of cortisol comes in, you may need low volume at times just from a recovery perspective. So that's important to note. So particularly as it relates to the adrenal glands, and particularly as it relates to epinephrine and norepinephrine, okay? So because epinephrine is involved in metabolic control, force production, and the response mechanisms of other hormones, stimulation of the catecholamines is probably one of the first endocrine mechanisms to occur in response to resistance exercise. So in other words, when you actually start to resistance train, you're going to, this is going to be one of the first hormones that gets released. So epinephrine and norepinephrine, when you begin a training session, these hormones are going to get released because of what they do metabolically, how they impact force production, and then how they actually allow the other hormones to play a role. So that's going to be kind of important to note as it relates to your resistance training. And again, we still want to limit, while again, acute cortisol plays a positive effect. If cortisol is chronically elevated, it'll suppress epinephrine and norepinephrine, and that'll impact what you could do as far as a training session is concerned. So manipulation of the endocrine system as far as resistance training is concerned, so just to kind of sum up, so to increase testosterone, you want large muscle group exercise, heavy resistance, moderate to high volume, 30 to 60 second rest intervals, okay? And make sure you want the resistance to be relatively high, 85 to 95% of a 1 rep max, and make sure you're getting enough volume in. As far as growth hormones concerned, you want to get higher lactate, which you'll get with the short rest intervals. Again, relatively high intensity, which is what we just talked about with testosterone. Again, 3 sets, short rest interval, and again, the key with the growth hormone is, in addition to the resistance training protocol, is to make sure to consume carbohydrates and proteins both before and after the workout. Because again, that, as we talked about, will kind of influence some of those, the impact of those other hormones as well. Okay, so other hormonal considerations. So there's various other hormones in the body, and they could certainly play a role as far as resistance training. However, you know, with these exercises, with these hormones rather, I apologize, we're not quite sure what the adaptations are to resistance training, and part of that is because healthy individuals tend to have a pretty tight control over how these hormones actually work. So things like insulin and thyroid hormones, the body has kind of a pretty specific mechanism for regulating them. However, we do think that they still will play a role in the mechanisms as far as, you know, the exercise stress and the body's ability to adapt. However, we don't know if chronic training adaptations will cause a change in resting concentrations. So in other words, we're not quite sure if, we don't think, rather, that, you know, chronic training or long-term training will change the resting concentrations of these just because of the effects they have on the body. Now, things like improvements in insulin resistance have been observed related to resistance training. So in other words, people tend to utilize insulin more efficiently. So in other words, sedentary individuals develop insulin resistance because they're sedentary and typically their diet's not very good, so their body kind of forgets how to use insulin. They become insulin resistant. Well, individuals who resistance train, at least acutely, we know, will have better use of their insulin. Now, we do think that there, over time, you may get a chronic effect with that. In other words, if someone resistance trains over a longer period of time, they may end up being able to have kind of a more chronic effect. In other words, their bodies just in general will consistently utilize insulin better, as opposed to it just being after a training period. So we think that these hormones will play a role in the effects from resistance training. These are just a little bit harder to study because of how they're utilized in the body. And these are your learning outcomes. So again, be able to describe all the hormones, their resistance, and their how they impact resistance exercise. Again, just also the general physiologic roles. So again, that other video that I have on the review of the endocrine system, make sure that you review that as well, because you'll be responsible for knowing all the hormones, the endocrine glands that they get released from, and what their various effects are in the body.